Good evening, everyone. This is Dr. Kaushik from Mumbai again with a new talk show here on the Sapien show. The title of today's talk is Kids Love Us, Parents Trust Us, and We Care for Them. Today's guest of honor is an exemplary, innovative, ahead of time, visionary pediatric dentist, Dr. Ashwin Jawdekar, sir. Welcome, sir.
Thank you.
Wish you all our viewers a very happy Children's Day. On a view of this Children's Day special, we are here with Dr. Jawdekar. So, what is your opinion? Like, how often the children visit dental clinics? Actually, the parents have the initiation to take their children to the clinic. And what is your opinion? And what are the standard that is being followed? The protocol is followed by the parents.
Okay, now in my experience, many times children are brought to us only after they start suffering from pain or some symptoms, which is not the best time actually. What is recommended is the child's first visit to a dentist or a pediatric dentist should be by around first birthday of the child. That means soon after the eruption of the first teeth, milk teeth. And thereafter it should happen every 6 monthly. So if the child is brought to us regularly and before any problems start, then we can guide the parents on how to take good care of their teeth, and we can monitor the progress. We can also see the developmental milestones in terms of eruption of teeth, and we can provide a variety of preventive care. So that's what is recommended. Unfortunately, when a child comes to us with a lot of pain or sometimes a swelling or hasn't slept the previous night before, then we have a certain limitation, because when we carry out any treatments, the child has to cooperate for the treatments. And a child who's already in pain, in distress, and we have to do something invasive, say extraction of a tooth for that child. Why should the child like it? Why should the child cooperate for it on day one? But on the other side, if the child is brought to us well ahead of such complications, if the child has already made friends with us and we have provided some preventive care to a child previously, first, such a complication is rarely going to happen because the child has been monitored and cared for. And second, because the child is already friends with us, it is easy for us to deliver good care. So I would definitely recommend a 6 monthly visit starting from the first birthday of the child.
Do you tell me the recommendation, what is the exact number of years that a child when initiate to come at a dental clinic, and what are the international guidelines that have been put forward for it?
Okay, the recommendation that I told you just now, that is the first checkup by first birthday, or a little in details, first checkup within 6 months of eruption of the first tooth in the child's mouth is recommended by the American Academy of Pediatric Dentistry. And now this is endorsed by several bodies and it is recommended world over. So that's the first thing. And a 6 monthly follow-up is, I would like to say that it's a general recommendation. If the risk of the disease, say to decay, is higher, or if there is any other problem for which the child requires more frequent visits, then the dentist would recommend those as per the need.
Sir, will you tell me what are your favorite aspects of a pediatric dentistry in clinical as well as on research level, if there is so?
Sure. Frankly, I can't say that only one thing is my favorite, but I would like to tell you something that's very close to my heart. And the thing that is close to my heart is preventive pediatric dentistry. In fact, I need not say that it is preventive pediatric dentistry, because pediatric dentistry by definition has a preventive aspect in it. And we have the best opportunity to prevent a lot of conditions. Unfortunately, about 50% children in India by the age of 5 years, they have tooth decay. Anywhere between 15 and 30% children, they suffer from traumatic dental injuries across different ages. About 10 to 15% children have hypomineralized teeth, or they have teeth with deficiency in enamel. And there are a lot of other conditions such as developing malocclusions, basically related to the alignment of teeth. And many of these conditions are preventable. So my key area of interest is preventive dentistry. And I like to practice evidence-based and need-based. So just because a lot of things are available, we shouldn't burden a child or a parent with everything. Like we shouldn't bombard a lot of care onto them. We should practice what is evidence-based and what is need-based. So basically there are three aspects of it. The clinician's judgment of the problem, the patient's perception of what is needed, and the third is the current based evidence. What is the standard of care? So when we integrate these three aspects, the outcome is quite fulfilling to me as a provider and to the patient as a receiver.
सर आप मुझे ये बताइए, एक पीडियाट्रिशियन और पीडियाट्रिक डेंटिस्ट के बीच में कौन सा रिलेशनशिप होना चाहिए, एंड अवेयरनेस ऑफ दैट शुड बी देयर इन द पेरेंट्स वर्कफ्लो सो दैट दे केम with their child to the pediatric dentist as they go to the pediatricians.
जैसा मैंने पहले आपको कहा कि एक पीडियाट्रिशियन के पास जाने के लिए पेरेंट्स को कई सारे रीजंस रहते हैं. एक रीज़न तो ऑफ कोर्स अगर बच्चा बीमार है तो पीडियाट्रिशियन के पास लेके जाना चाहिए, लेकिन वैक्सीनेशंस के लिए या एक वेल बेबी चेकअप्स होते हैं जो हाइट, वेट, बाकी डेवलपमेंटल माइलस्टोन्स जो बच्चों के हैं वो पीडियाट्रिशियंस मॉनिटर करते हैं. सो थोड़ा बहुत ऐसे ही होना चाहिए, और ये हमने पीडियाट्रिशियंस को भी इन्फॉर्म करना चाहिए और ये कोशिश भी जारी है. पीडियाट्रिक डेंटिस्ट्री प्रोफेशनल बॉडीज़, पीडियाट्रिशियंस प्रोफेशनल बॉडीज़, they have been interacting on different topics together. So to decay prevention and obesity prevention, they are linked with each other because both are diet related. So दोनों के लिए जल्दी और पहले चेकअप होना ज़रूरी है. पीडियाट्रिशियंस उसमें से कुछ न्यूट्रिशनल एस्पेक्ट्स के बारे में बच्चों के पेरेंट्स को गाइड करते हैं, हम भी कुछ एस्पेक्ट्स के बारे में गाइड करते हैं. बट ये इंटरेक्शन इसलिए ज़रूरी है कि मैं सिर्फ एक एग्जांपल देना चाहता हूँ. बॉटल फीडिंग दैट इज़ डिस्करेज्ड बाय पीडियाट्रिशियंस, दैट इज़ डिस्करेज्ड बाय पीडियाट्रिक डेंटिस्ट ऑल्सो, एंड ब्रेस्ट फीडिंग दैट इज़ प्रमोटेड बाय पीडियाट्रिशियंस एज वेल एज प्रमोटेड बाय अस, and both have important implications in terms of not just teeth but the overall health. So ये interaction बहुत ज़रूरी है. और आजकल कई सारे पीडियाट्रिशियंस भी ये जानते हैं कि बच्चों को इतने सारे डेंटल प्रॉब्लम्स हो रहे हैं, तो पेरेंट्स को ये इन्फॉर्म करें कि बच्चों के डेंटिस्ट को जितना जल्दी हो सके दिखाएं. और ये अवेयरनेस भी बढ़ रहा है. और आपने सही कहा कि एक रूटीन विजिट जैसे पीडियाट्रिशियन के पास शुरुआत में होती है बच्चों के चेकअप्स के लिए, वैसे पीडियाट्रिक डेंटिस्ट के पास भी होनी चाहिए, और वो हो रही है, धीरे धीरे हो रही है. और दैट्स अ गुड इन्वेस्टमेंट टू मेक फॉर पेरेंट्स इफ दे वांट गुड हेल्थ, डेंटल हेल्थ ऑफ द चिल्ड्रन. देयर इज अनदर पॉइंट दैट पेरेंट्स ट्रस्ट द पीडियाट्रिशियंस अ लॉट because they have seen the baby almost right from birth, and any advice that is given by pediatricians is accepted by the parents very well. Also, pediatricians often have to just do a simple task, that is lift the lip of the child, or they can ask the mother to lift the lip of the child and they can notice if there is any dental problem, so that they can inform the parents in time. And as far as my profession is concerned, I can say this with pride, that pediatricians guide us a lot, and they are like our elder brothers to us. And in real life too, my elder brother is a pediatrician, so he has guided me very well in my training as well as in my practice. So
that's so cool.
It's a good brotherhood between pediatric dentistry and pediatrics.
Yes. सर ये आप मुझे बताएंगे कि 0 से 5 years ऑफ एज के बीच में कौन सा टूथपेस्ट यूज़ करना चाहिए और टूथ ब्रशिंग टेक्निक्स कैसी होनी चाहिए, एंड पेरेंट्स को असिस्ट करना चाहिए कि नहीं?
ऑफ कोर्स हम दोनों चीज़ों के बारे में बात करेंगे. एक तो क्या टूथपेस्ट रिकमेंडेड है, और दूसरा क्या ब्रशिंग टेक्निक रिकमेंडेड है. सो देर आर 3 टाइप्स ऑफ टूथपेस्ट अवेलेबल. एक जिसमें फ्लोराइड नहीं होता है, दूसरा जिसमें फ्लोराइड होता है लेकिन कम मात्रा में होता है, जिसको हम जूनियर फ्लोराइड टूथपेस्ट कहते हैं, और तीसरा जिसमें 1000 ppm तक फ्लोराइड होता है, जो रेगुलर फ्लोराइड टूथपेस्ट है. सो नॉन फ्लोराइड टूथपेस्ट हम 2 साल के पहले के बच्चों को रिकमेंड करते हैं, क्योंकि उसमें से कुछ टूथपेस्ट ऐसे भी अवेलेबल है कि जो बच्चों ने स्वॉलो किए तो भी हार्मफुल नहीं है. सो सच बेबी टूथपेस्ट वी रिकमेंड टू चिल्ड्रन बिलो 2 years. Between 2 and 6 years, we recommend junior fluoride toothpastes which have about 500 to 550 ppm of fluoride. And they also may have agents like xylitol, which are helpful in the prevention of tooth decay. And above 6 years, we recommend regular toothpastes which contain fluoride. Now, additionally, also we make a few recommendations, such as above 6 years, based on the risk of tooth decay, we recommend fluoride mouthwashes. So, twice a day brushing with a fluoride toothpaste and once a day use of mouthwash. That's additionally beneficial because fluorides can strengthen the tooth enamel. And below 6 years, we don't want to give excess fluoride. So, we sometimes recommend other remineralizing or enamel hardening agents, such as there are formulations available with CPP, ACP. I don't need to go into the details of the chemistry, but there are other remineralizing or enamel hardening agents available. So I think this part explained what agents we use, like toothpaste, mouth rinses. The other part is how should we brush the teeth.
That's important.
Now the chronological recommendations are, even before the eruption of teeth, we should wipe the gum pads of a child, of the infant. And that can be done with any clean handkerchief or a cloth, or there are certain wipes available. Okay, so those wipes can also be used. As soon as the teeth start erupting, one must start brushing the teeth, and their technique is not important. Just a habit of twice a day brushing has to commence at the time of eruption of teeth, say between 6 months and first year of age. And so long as the child has only front teeth, incisors, one can practice brushing with a finger brush, a brush that can be put on the finger, and the parent has to brush, of course. Once the molars start erupting, then you have to choose a baby or a junior toothbrush which is soft. And so the technique is not important. What is important is either we can use a vertical stroke motion or a circular motion. Okay. I can recommend one thing. There is a happy tooth song that we have uploaded on the YouTube. So parents can have a look at that. It's in both English and Marathi, and they can see the brushing technique. But let me repeat that the technique is not important. Practicing it is more important. So up to say 6 years of age or 6 or 7 years of age, parents must brush the child's teeth with a circular or vertical stroke motion. And a junior soft brush is okay. Above 6 or 7 years, the child can start brushing, and the parents have to supervise whether the brushing is appropriately done or not. Good solution also to any difficulty. There are battery operated brushes or electric brushes or powered brushes available. So they must select a kid's toothbrush which has a small round head, and that reduces the fatigue. It has a little tickling also to the gums, so children may enjoy it more. So this is about the toothbrushes.
Okay. Indeed, it was a very resourceful, informative information that you have been sharing since past 20 minutes. We would like to know, you have been awarded by Tony Volpe Award by Global Child Dental Fund in 2013. What's your call in the concepts of what is being practicing in the West that should be inculcated the same way in the Indian scenario? And what is your call on it?
Thank you for mentioning about the award of Global Child Dental Fund. I am really indebted to them that I had received. It indeed was a big honor to me. And now let me answer the question that you have. Frankly, there is not much of a difference in what is practiced in the West and what we could practice here. In fact, I like the statement, think globally but act locally. So whatever we learn globally, we have to implement it at every local level also. The West is more organized. They are more evidence-based. The training over there of a dentist is much more methodical. So what I practice here is a little influenced by that. Okay, because I have received training here as well as abroad. And we have to look at everything from the patient's perspective. Just because I've learned something over there, that doesn't mean the patient will accept it here. Okay, so if we work in the interest of the patient, we develop our thought process. Okay, this is what I have learned there, but yes, it can easily be practiced here. So that's how I like to keep my practice approach. So now let me give you one example. Preventive dentistry is given a lot more importance in the West, mainly because the disease level there is not as high as it is here. So if here I just focus only on preventive dentistry, that is not sufficient, because here the disease level is also high and I have to treat the problem as well. So here, like I see almost on a daily basis a child with all 20 teeth decayed. So I cannot offer only preventive care. I have to treat that problem, and along with that I have to offer some preventive care. So we give a comprehensive treatment plan which has both the aspects, treatment aspects. So we do a few fillings in the child's mouth, sometimes pulp therapies or caps, and alongside we also recommend a topical fluoride varnish or pit and fissure sealants. So these are some preventive modalities. So we integrate both and we offer the treatments to the parents for the child.
Will you tell me, like, have you ever encountered any medical emergencies while you are treating a child on a dental chair? If yes, and how you encountered it? Followed next question on it is like how you have managed the uncooperative children that visited your dental clinic.
Okay, so dental emergencies in the dental chair while treating a child is not something which is very common. I mean, there are some things such as when we use certain instruments, the child should not shut the mouth, but children are children after all, so they don't always follow instructions, so they close onto it, and we should be careful enough that we have not left something inside which can break in the tooth. So at times that has happened, but we have managed that. Then the other thing is, I don't know whether this is regarded as an emergency. They bite us also at times. So that's not an emergency for them, it's an emergency for us. So now we are used to it. Our fingers have thick skins now.
Yes.
And about their cooperation, I'm not saying that children are cooperative, and I'm also not saying that children are uncooperative. Children are children, they are not miniature adults. So we have to relate to them differently. We have to expect different things from them. We can't just talk to them just like we talk to adults. When we treat children, we have to understand that they have not come to us for treatments. They are brought to us by their parents for treatments. So it's not about pain, it's about their fear at times, it's about their anxiety at times. Because at times at home they are told somewhat like, because you are not brushing your teeth properly, we are taking you to a doctor. Or because you eat a lot of chocolates, the doctor is going to give you an injection. So why should they enjoy a doctor's visit? They would rather look forward to the visit as a punishment. So if they are prepared like that, then they are not going to be friendly with us from the beginning. But having said that, we have to initiate a certain dialogue with them. We have to build a rapport with them, and we have to do a few things which would motivate them, at least reduce their fear. So there is a certain approach, systematic approach. Dentistry is not painful in everything. Like, let me give you an example. We apply a fluoride varnish, which is as simple as brushing teeth at home. So we must do some such simple procedure first. We have to familiarize the child with the things that we do. There is a technique known as tell, show, do technique, which we practice regularly. There are a few things which we don't show to them or we don't mention in front of them, such as injections, blood. If we keep mentioning these things to them, then that might scare them. So telling something, showing or not showing something, and doing it in a systematic manner helps. So there are various behavior modification techniques also which we learn and practice. Dentists are behavior therapists. They are trained in child psychology, more so the pediatric dentists. And then it's a matter of experience also. Now broadly, I can tell you that above 4 years of age, most children do cooperate for most procedures if our approach is right and if the child doesn't come to us with excessive fear or a phobia. Between 3 and 4 years also, many children, they are manageable. And below 3 years, we call them pre-cooperative, and then we can't expect much cooperation from them. So now there are two possibilities here. If a child doesn't cooperate much, either we have to modify our treatment plan. Certain treatments are possible to give, certain treatments may not be possible to deliver. So we have to think about what is possible. Or the other alternative is, if there is an emergency, then we may have to deal with that in a hospital setup where the child is taken under general anesthesia. Because it's an emergency after all. The child cannot sleep or the child cannot open the mouth because of an abscess and that needs to be drained. Then some such thing may be required. Okay. But by and large, again I will go back to what I said in the beginning. If there has been a routine preventive care provided by the dentist and good follow-up maintained with the pediatric dentist or the dentist, then such a possibility is rare. Okay. So one, complications can occur and nobody wants them. As much as the parents don't want, dentists also don't want any complications. And two, about the uncooperative behavior of the child. Yes, we are trained and we try to do our best so that the child becomes cooperative, but we can't expect 100% results because, as I said, children are children.
Had you ever encountered treating a special needs children on a dental chair, and if yes, what was your experience, and please explain that.
Of course, I do come across a lot of children with special care needs. The common ones are children with cerebral palsy, which may have different levels of understanding difficulties. Also, children with attention deficit hyperactivity, that's a common problem that we see in children. Other conditions such as Down syndrome children we come across quite a lot. And we try to treat them in the dental chair. But as I mentioned to you about uncooperative children, we have to assess their cooperation in the first couple of visits. We start normally with non-invasive preventive care such as a fluoride varnish application. These days there is a substance available known as silver diamine fluoride, which can be applied onto cavities which have not reached the root canals. So this can help arrest the decay process or slow down the decay process. So use of some such agents in the early treatment plan can help control the disease, although it may not eradicate or completely treat the problem. So we start with some such non-invasive care, which requires very little time in the dental chair, very little attention and cooperation from a child. And in the process, along with this, if we are able to establish good communication, then we try treating problems in a sequential manner. Maybe if the child is cooperated well for some such things, we try to do a few fillings or restorations. Then we might try to do something more, say a cap if it is required. And I have treated many children under local anesthesia up to say tooth extractions or even pulp therapies, a root canal type of a treatment. Of course, I can't generalize and there is no one approach that will suit all. So every child's cooperation, every child's level of condition must be assessed, and then only we can tailor make the treatment plan. But yes, it is possible to treat quite a few conditions in the dental chair. Now, if again, as I said earlier, if there is an emergency to deal with, or if the condition, the medical compromise is to that extent that it is not safe to treat the child in the dental chair, then we would recommend hospitalization and treatment under suitable anesthesia.
Sir, will you please explain me which innovative ideas that you have proposed in your daily practice as well as teaching as a profession?
Of course, I'll be happy to talk about a few. Let me begin with one idea which is very close to my heart, that is writing a good prescription. I often came across this, that dentists do not write, and many doctors also do not write a prescription that is very legible in terms of handwriting, and often the pharmacist or the patient doesn't understand what is written on the prescription. When it comes to prescribing medicines to children, it's far more complex because the dosage has to be properly calculated and then prescribed, because it is as per the weight of a child. And I often joke about this, that why I became a doctor, because I hated mathematics, not because I was interested in dentistry or medicine. And so I never liked to do those calculations. Of course, it comes with practice that we remember a few drugs and their dosages well. But I really struggled teaching it to all the students. A few students would pick up very well how to prescribe dosages properly. A few students wrote the prescriptions also very nicely, but a few couldn't. Then I thought of an innovation. Why not have an app for this? And then we came up with an app,
In this
an Android app.
era.
Yes. An Android app, Prezi.
Okay.
Prezi is writing prescriptions made easy, or prescribing children made easy. So we just have to register once, a dentist has to register once, and then right from the entry of the patient details such as the name, age, weight, till the selection of drugs and creating a PDF or a text message which is ready to share, it just takes about 50-55 seconds. And it accurately calculates the drug dosage. There's no question of handwriting there because it's a PDF generated. It can be shared with the pharmacist, with the patient, and it can be kept as a digital record also. So now one can choose to either write a prescription or make a prescription using this Prezi app. So now, as far as the research and teaching is concerned, we have done some research on this Prezi and we have published a paper. And our second paper on this is also underway. It will be published shortly. So this is one thing that can change the perception of the patients also about the doctor, because now a better prescription is available to them. Now the second innovative idea that I started working on was a Caries risk assessment app. Okay. Now I mentioned to you that we need to not only treat the disease, but we need to prevent the disease. So we need to take into consideration the risk factors. What is causing the disease, say tooth decay. So there is another Android app known as CRAFT, that is Caries Risk Assessment for Treatment, that we developed way back in 2016. And after a lot of research on it, we have so far done at least 5 research projects on it. We have now made it available on Android, and this is a free app any dentist can download. And the CRAFT assessment can guide both the patient and the dentist about the preventive care and treatment options. So again, we can make recommendations to the patient how they should take better care of their children, to parents how they could take better care of their children to prevent tooth decay, and it also guides the dentist about how they could choose certain treatment options based on the risk category of the child. So this is another innovative tool, and I'm happy to share that our research and presentations on the CRAFT have been noticed both nationally and internationally. CRAFT is a tool that is accepted by the Dental Council of India as a proposed tool for caries risk assessment. There was a conference that happened in 2018 in Mumbai, first decade, no decay, where I had presented this and it got accepted. And the same year later, in 2018 November, I presented some work on CRAFT at International Academy of Pediatric Dentistry conference, and I won a prize also there for my work on CRAFT. It's not my work, it's my work with my students, my fellow colleagues.
It's a teamwork.
Yes.
Yeah.
So That's also an achievement, because now this tool is a well recognized and well studied tool, which is available as an Android app, which is free to download. So we are going to give some links in the description below, so you could access more information related to craft or related to Prezi, and dentists can use these apps also for the better patient care. So these are the two things which I thought I could talk about in terms of innovation. There are a few other areas that I'm working on, and I'll be happy to share once those are through.
Sir, will you please explain me, for the betterment of the oral health in the children, what are the aspects a pediatric dentist should consider, and what is your opinion on it? Please elaborate it.
Certainly. In fact, pediatric dentistry is not just about teeth. Let me first explain you the horizons, or rather the scope of pediatric dentistry. We want children to breathe well, eat well, sleep well, play sports safely and enjoy sports, have a good posture, have a good smile, and have an overall good health. And in the next part, I'm going to explain to you how we look at children holistically for all this. Children often have a lot of deleterious oral habits, such as they breathe through their mouth and not through their nose. We call this a mouth breathing habit. Or sometimes they have a digit sucking or a thumb sucking habit. They have a deviated swallowing pattern, or their mastication, chewing ability doesn't develop well, because a lot of modern diets, they are just soft foods. So if we come across children with such problems, we deal with them and we try to correct these deleterious oral habits. That will have good impact on the orofacial musculature and the overall jaw development, which is essential not just for looking better, but for proper functions, such as if the mouth remains closed during sleep, then there is no sleep disordered breathing. That reduces snoring, that increases the calmness of sleep. A child can sleep better if the orofacial functions like breathing is happening properly. So if a child sleeps well, there is better development of cognition, memory, and the child's overall intellectual development also happens better. Also, as I mentioned, the jaw growth and the muscular functioning is essential for a proper posture of head on the shoulder. That means if the head is stable on the shoulders, then the trunk as well as the extremities, they get aligned better. So overall posture of that individual is better. So we assess these aspects of orofacial function. In fact, I have founded one organization. I am a founding president of that, Foundation for Orofacial Myotherapy, and we have about 160 life members of it, and this is the 4th year of our organization, and we look into a lot of such aspects. Now, apart from that, as I mentioned to you, children suffer from a lot of traumatic dental injuries. So some children are injury prone because of their facial profile. Their teeth are forwardly placed. So guiding them about correction of that profile, also giving them sports guards if they are involved in contact sports, this comes in our purview. Also, there are other problems such as I mentioned to you about hypomineralization. That means if the teeth haven't developed well, then we have to protect them, or we have to do some early treatments for those hypocalcified or hypomineralized teeth. So these are just a few, whatever that I've told you, they are just a few aspects of pediatric dentistry. It's really a huge branch. Okay. Some aspects which not all, but a few pediatric dentists do work on are cleft lip and palate rehabilitation. So that's also a big field, and we can guide the parents on how to feed the child if the child has a cleft lip or a palate, which can be a problem in the early development. So there are many aspects of pediatric dentistry. I have spoken a lot about tooth decay prevention and the treatments related to that. That's the biggest actually. About 80% of the problem that we see is related to tooth decay, and the rest all is 20%. But those all are also very important aspects of pediatric dentistry. Parents often ask me such questions, but doctor, these are children, they are going to like sweets and they want sweets, chocolates, biscuits, all these things. So how can we deprive them of the pleasures of this? And then I tell them that yes, they do like it, I understand, but actually sugar is as bad as tobacco, if not worse. And the reality is sugar is causing a lot of health conditions in children, and we are the first ones to notice these in terms of the problems related to teeth. But later, if such heavy sugar overload continues, there are risks such as obesity, coronary heart disease, diabetes type 2. So as dentists, yes, we focus on the treatments of dental conditions, but we also make them aware of such possible health conditions if the habits are not controlled. And there are some innovative ideas that I have told parents that they can practice at home. For example, I tell them about a sweet Sunday. If a child likes a sweet, let it be given to him only on Sundays. Say this Sunday they can eat a chocolate, next Sunday they can eat a cake.
Like we do the cheat days.
Yes, but instead of cheat days, let us call them sweet days. Okay, so that they don't demand it every day, because taking a sweet once a week is not going to be that big a risk. But I often see children who consume it every day. That's definitely a risk. Okay, so this is one idea that I often share with the parents, and they practice it. So I think you asked me about different innovative ideas. This is again a very simple idea. The other idea that I proposed, and I'm happy to share that it has gone nationally, that a no sugar day. So soon we are going to have a national no sugar day, and I had proposed it in a recent meeting of Federation Dental International and Indian Dental Association, and that has been included in the Mumbai Declaration against sugary drinks. So soon we are going to be observing a national no sugar day. So these are a few ideas.
It was indeed an amazing discussion with Dr. Ashwin Jawdekar, who is right now head of Department of Preventive and Pediatric Dentistry at Bharati Vidyapit Dental College, Navi Mumbai. Thank you very much, sir, for getting your precious time for us and your blessings and giving the information about the pediatric dentistry to our viewers.
Thank you.
Thank you.
Keep up the good work. It was really an enjoyable session for me as well. Thank you.
We wish all our viewers a very happy Children's Day and a very happy Pediodontist Day. And on this eve of a beautiful day, we are just presenting ourselves. Do please like, share, and subscribe our channel. I am Dr. Kaushik from Mumbai. On the Sapien show, we are signing off. Thank you very much.
Thank you.